When people think about anxiety, they often think about racing thoughts, excessive worry, or feeling nervous. But anxiety does not always begin in the mind. Sometimes it shows up in the body first. You may notice tension in your shoulders, a tight jaw, frequent headaches, fatigue that never seems to fully go away. You might experience stomach discomfort, muscle tension, difficulty relaxing, or a constant feeling of restlessness. And because these symptoms feel physical, many people do not immediately connect them to anxiety. They assume they are simply tired, overworked, stressed. But anxiety affects more than our thoughts. It affects the nervous system. When the brain perceives stress, the body responds as if it needs to stay alert and prepared. This response can be helpful in short bursts. But when stress becomes constant, the body may remain in a prolonged state of activation. Muscles stay tense, breathing becomes shallow, rest feels less restorative, and even small challenges can feel more exhausting than they should. Over time, these physical symptoms can become part of everyday life, so familiar that they begin to feel normal. You continue working, you continue showing up, you continue pushing through. And from the outside, everything may appear fine, but your body may be sending signals that something needs attention. These symptoms are not a sign of weakness, and they are not something you are imagining. They are real experiences that deserve understanding, because anxiety is not only something we think, it is also something we feel. And when we begin to recognize the connection between the mind and the body, we can respond with greater awareness and care. Therapy can help identify the patterns that keep anxiety active and provide tools to better manage both the emotional and physical impact. You do not have to ignore what your body is trying to tell you. Sometimes those physical symptoms are not the problem, they are the message. And understanding that message can be the first step toward feeling better.